Well, we're broadcasting live, Ed, right now. I'm not seeing chats, but that might start happening. If we don't, that's okay. I think we can just have a chat about some of the things that are going on and what your role has been and what you kind of see is happening, and some good, maybe rules of thumbs that some gyms can be thinking about. So, just to introduce you, Ed Campbell is a virologist in the University of Loyola in Chicago, correct?
Mhm.
He's also a education board member in his local school district. And he, with his wife, Chris Campbell, is a part owner of Gemini Gymnastics. So he has a unique mix of knowledge of both our industry and obviously the industry that's of fourth of importance right now. So, Ed, do you have, what's your first things that you want to maybe share that people should be thinking about in regards to, this current situation? I know we've had a bit of a chat.
Sure. Well, I mean, I think one of the things that's important to realize as, everyone is negotiating the decision of, remaining open or not, or how to stay open are a few key things, because I think in the face of a lot of the school closures, there's going to be necessarily a little bit of anxiety about remaining open. And I think, everyone has to think about that, and it's going to be different based on the realities of these communities. But, something that, in talking to my wife, that was a really important point that I think everyone should be aware of is, obviously we've talked about, students and children that tend to be students at these gymnastic schools are really the lowest risk group for, significant complications, during or following infection. And, when people like me, my board of education was really supporting the closing of these public schools. The reason that we're doing that is because not really to protect the students, because they're not really in danger of these significant complications. In fact, in a way that's remarkable and that no one expected when the outbreak first started, it's unlike flu in that the lower age groups actually have less complications or the same number as regular flu. Older people have much more complications and mortality associated with COVID-19 than flu. And that's really the reason that drives these school closures, right? Because children and the number of children that come together in schools are really the ideal vehicle for the kind of spread of a pathogen throughout the community. And really remember that these closures are being, initiated to prevent the kind of explosive spread of the virus in the population that the healthcare system can't accommodate. But the reality is that in the next year, and maybe if you live in a very rural place, this doesn't apply to you, but as a resident of a suburb of a major city, Chicago, like everyone in my house and most of the people in my neighborhood are going to end up infected with this virus in the next year. And that's just epidemiology and math. And what we're trying to do is prevent that explosive spread that really overwhelms health systems. And the reason for that, if anyone is doubting that, Italy kind of took a cavalier attitude towards the virus. And really the increased mortality that they're seeing is because they simply don't have the respirators and other supportive medical equipment needed to help all the patients. So they're basically triaging patients by age and other, are they more likely to be saved by this treatment or not? Even though these treatments generally do really help the patients, and give them a chance to survive. So patients aren't getting the chance to have access to the care that they need. And that's, in many cases, close to a death sentence for them. And so as long as we as a community make sure that our healthcare systems are able to deal with the flux of people, there's going to be a constant level of infection, right? But the other reality is everyone talks about, bending the curve from this arc that we've all seen on Facebook now to something flat. The other reality is when you flatten that curve, you also extend it temporally. And then I think the question for gym owners or other owners of, businesses like a gym is, can I wait for the last person in my community to be infected by COVID-19 before I reopen? And I think the reality for the vast majority of gym owners is no, you cannot, right? And so then what is the solution to that? I think, what we've come up with is really trying to focus on, number one, making sure that the gym, if you're going to open, you're really exclusively focusing now on low-risk patrons, and not just the patrons that are the students, but you have to alert customers that if they have somebody cohabitating, if you're living with grandma, maybe you shouldn't come to class. If you have a mother with hypertension or cardiovascular comorbidities that are known to be associated with worse outcomes, then continuing attending class is not for you. But at the same time, we've also heard from a lot of customers that want to have some level of activity, remain available to their students or their children, and some level of normalcy and routine, right? Because this is certainly the most disruptive reality that children, since I've been growing up, have ever encountered.
Right.
And so you want to find a way to try to service and keep those customers that you can provide a good experience for, while explaining to other people that look, we're staying open for this group of people, but it might not be for you.
Yeah. So, there is an element of hunkering down. And there is an element of normalcy that we're trying to balance. Most gyms don't have months of reserves to be able to just be shut for months at a time. So, how do we handle it? And one of the things I think is something to be thinking about as a community, and I wanted to ask you about it, was, obviously there's healthcare workers, and there's people that need to work and they can't afford to not work, and if all the schools are closed, they're going to be looking for places for kids to go to. That, do you, as a virologist, knowing the situation that's going on, if a gym is very thoughtful and careful with its cleaning routine and so forth, is it a viable and reasonable thing to be able to offer a place for those kids to be able to come, like a day camp?
Right. So, and I think it's not just healthcare workers, but I think in the response that we're generating and the communication that we're going to send out soon, we're going to offer a discounted rate for people in the healthcare industry, because those are the people that we can't take off the front line with a school closure, right? Now, we as a gym are taking, some measures, like really in the 15 years that it's been in existence, my wife's gym kind of has a reputation for being the really clean, attentive to these kind of details anyway, establishment in the neighborhood. And we're obviously doubling those efforts, but we can also do things that frankly wouldn't pass legal muster in schools. So now we're going to have a thermal thermometer or a forehead thermometer, and every student that comes in is going to be scanned with the thermometer by an employee who was scanned when they came into work.
Right.
And in that way, the goal isn't, and I think no one should promise that no one will ever be infected, at their place of business, because it's just as likely to happen, it's likely to happen when you go to the store. It's likely to happen if you go to a restaurant. And what you can do is minimize that risk.
Right.
And I think we're pretty confident that with the small class sizes we have, and the actions we take, you want to make sure that you're not contributing to community spread in a way that will impact the healthcare system.
Right.
But if you're careful and you're meticulous and you're cleaning before and after classes, sometimes high contact surfaces during a class, you can really alleviate a lot of those concerns to make sure that you're not going to be really part of the problem. And I think if you're doing that and you have classes that are, 6 to 10 kids, you can have a few of those. A public school, for example, has, 24 classrooms, all with 30 kids in them, and there's points where they're all walking through the same area every day. It's not practical or plausible to clean all those areas the way they would need to be cleaned. And it's also not legal to, take their temperature without all kinds of paperwork. Whereas in a private business, I think everyone appreciates attention to safety and are more than willing to comply to these things. And in this, unprecedented time, if you're not willing to get with that program, you might need to go somewhere else, because we're trying to protect everybody and offer them, a chance at activity.
Right. So would you, I think you mentioned this before off live, you, obviously the schools from a financial standpoint, no one's going to be refunding money, and in the colleges, they've been paid their money, and there's not going to be refunds to the college kids and so forth. So it is easy for them to close. Most gyms aren't operating in that way, right? They're not paid for the year, and they don't have government funding. So whilst there is larger congregations at schools and colleges, maybe 500 plus or more, which would probably be a risk. I think it's California, it's 1,000. Is that kind of like the government's thing right now? Is that it's 1,000?
That's the number you see going around right now. Is usually about 1,000. Same in Illinois.
Which isn't happening in the gyms. And because most gym owners, are working month to month, that because they're pretty much working at 100, the crowds of 100, that we're kind of along the same lines as, say, a grocery store or something. There's 100 people in a grocery store. Can we be looking at that, and hey, if a grocery store is shut, that maybe that's a sign that we should be looking at it if we're voluntarily doing it, rather than, hey, if a school system shuts, maybe we should.
I mean, absolutely. And there's going to be a bunch of other signs that, and we can do another one of these chats in 2 weeks, because, we can speculate on how it's going to be in 2 weeks, but we just don't know.
Right.
Like if you're seeing convention centers that are empty being repurposed for temporary hospitals, and the path forward that we've charted might not work, and you've got to explain that to people. But, at the moment when you don't have this kind of overwhelming level of community infection and you're really just kind of bracing for it, closing now, the reality that we were facing, because everyone seems to be pulling the plug right now, is in 2 or 3 weeks when you would need to reopen to remain viable, well, then you might be really trying to reopen the door when the hurricane is, hitting land. Right. And that's going to be even less plausible. And you might need to close during that time, right? But minimally, you can reach out and understand things about like the number of infections in your neighborhood or area. And, these are going to inform your ability to make the right decision for you and, I guess, your gym clients.
Yeah, and it sounds like from a nationwide standpoint, it's going to be kind of like a rolling thing, right?
Yeah, it's going to break out in some neighborhoods. Like there's right now, like New York is bad in general. They've had a number of cases, but there's a neighborhood in New York that's literally under like National Guard quarantine because they had a little bit of a blow up first, right? And you're going to see more and more of that. It's going to be unavoidable. And I mean, that's the important thing to realize, and I said it before, but I'll say it again, like in the course of the next year, we will all get infected by this. And frankly, emerging on the other side of that to some degree requires that. Right. Because, there's some reports that, you can get infected a second time, but those are not, there was also a report that coronavirus came from snakes. And I would view that with a similar level of skepticism. When you clear these viruses, it's due to an adaptive immune response. And this virus is not very genetically mobile in its ability to evade those kinds of responses. So I think at some point, like, are we going to close until like the last person is infected? It's not even close to plausible. Right. So what you can do is you can offer people, normally if a kid misses a class, you got to schedule a makeup within a certain time period. And I think one of the valuable things, and I think you helped us with this, is getting, our clientele on auto debit, where I already have spoken to some of our clients where they know they're not going to send their kids. They're probably not going to bother us for makeups, but they are supporters of the gym where they're just not going to cancel, right? And so it might be a little bit different depending on how each gym is billing their customers. But in our case, in our letter, we're going to be like, here are your options. Like you can keep coming to class if you feel like you're a low risk, and we're explaining what that means. But, you can also not attend for a while. And when this is all over, we're going to have additional classes that'll just be for makeups to make sure that we'll make it right with you, with the hopes that people don't just flat drop. And there will be some this is not going to be a really good month or two compared to year over year analysis for a lot of gyms. But this is one of those storms where you just want to weather it, right?
And this is one of those things where what we're trying to do is make sure that our whole community and all of us come through it, come through it. Some of us are going to be scathed a little bit, but at least we're going to survive and get through, and hopefully the economy will we'll come back to somewhat normalcy, and we'll be good. We're heading into I mean, obviously you'll be heading into the summer and so forth, and hopefully the Olympics will still be going. That's still to be decided.
No,
And
it's really hard because an Olympic year is usually a really good year for people in our profession, right? And
right. Yep. And so, I think so. This is just summarize a little bit of some of the things that the gyms can do and should be okay with at this time. And Ed, maybe we do a follow up next week or something at the same time. But right now, I think it's reasonable for them to stay open, even if their local school area closes, unless obviously their local government officials have forced everyone to close. But unless you have actually been forced to close by your local authorities, according to Ed, and I kind of feel the same way, but I don't really know what I'm talking about apart from just making sure that you guys survive and do well, that we can stay open, that we do need to change maybe a few operating procedures, checking temperatures as people walk through the door, with the little, what is it called, a thermo scan, or
it's like a thermal scan. It's not invasive, so you don't have to worry about communicating disease between people. And obviously, we're already doing things like hand washing everybody or hand sanitizer as you enter the gym and as you leave. Like, these are all obviously really important things.
Staff maybe washing hands between classes, and all of that good stuff. If we can do that, I think we're adding to the helping the situation, because I think what we're trying to make sure is that 90% of us are going to be okay. We might get a little bit sick. Some of us will get less sick. Some of us will get mildly sick. We're trying to protect the 10% that are really, really at risk. And the best way to do that, from what you're saying, Ed, is to actually just stretch this out. I think I read that there's 990,000 hospital beds in the United States. So what we want to do is make sure that we keep enough down, but not even that. It's the risk, how many respirators there are, and so forth, right? So if it comes out nice and flat, and it's not like a huge spike in 1 week, but the trajectory is over 2 months, it actually can be something that can be quite manageable, and it will turn out better than hope.
And I think something else that's important is I think when you're communicating this, if you're dismissive of the realities that this virus is presenting, you run the risk of really not having that communication age well. And we've seen that, in other circumstances that we're all aware of. So I think it's possible to be direct and clear with your clientele of, here are the reasons that you might not want to come. And I think people will respect that. And then you don't have to try to, walk it back when you were feeling like it was not something that was a very big deal. And then, it, impacts people in your community in the worst possible way. Right. So, I mean, it is a serious thing. But for the majority of people, like you said, the symptoms are likely to be mild. What you have to make sure is true is that your gym, for the sake of everyone, right? Because, a few bad gyms being traced back to some spread is going to really put all of us at more risk of losing more clients. Is you have to make sure that your gym is not a part of this community spread, right? Because, we're socially, there's a civic responsibility to make sure that that's not true. And we have to balance that with, the responsibility that we have to kids, where it's like, I think we're a valuable part of the community and a lot of communities. And I think there's a lot of our clientele that are willing to give you a break for that. There's going to be some people that are outraged maybe that you're staying open, but I think you can just explain, like as we were talking about earlier, like the other option of just going and building a dying hole and dying as a business. We didn't view that as, the best outcome for our enterprise. Right. So we don't have a lot of options, and the options are really to try to focus on providing service to the people that are very low risk and making it clear that that's the group we're trying to support, and, helping people know if they're in that group or they're in a more high risk group where they should wait a few weeks before they come back.
Right. And I think basically in a nutshell, at this point, obviously, where gyms can actually be a positive service to the community to help make sure that kids have a place to be, during this period where maybe the schools are closed, and we can control a lot more, because we're usually, as gyms, we're a much smaller space, so we can actually control the flow of traffic and how people are being handled, rather than an open space of a school or a university. So there's a little bit more of a controlled environment that we can keep under wraps, and actually be a positive part of the community whilst the community is going through this difficulty, because many people are going to need support, and many kids are going to be stretched to a really great degree. Now I'm just going to check some of the comments to see if we have any. If we don't have any, let's have a quick look here. Where are we? See me live. We got some comments. Oop, let's turn that down. So Deanna asked parents to limit observations. That's a good question. So would you say that it's a reasonable thing to limit parents' access to the gym?
Yeah, I mean, I know a lot of people are doing that, and so what we're doing is we're asking for one parent or guardian only, and no kids to be in tow. If the parents want to watch, fine. But we also, recommend dropping off and picking up.
Yeah.
Because I mean, just the sheer numbers of people is a factor to consider. And every gym is going to be different, because I've been in a few gyms. I don't think any two gyms have the same kind of observation area or space as any other gym. So you have to think about that and how your gym is suited to. And also, in terms of congregating in one space, there might be different rules about, if your gym is in a separate part of the building structure, that's another room. And from a public health perspective, then the people in one area wouldn't count. You wouldn't add the two people together and then maybe worry about going over 100, or if you're going over 1,000, you're a really big gym, and I want to know how you're doing it, right? But if you want to keep the number of people in each room down, these are things that every gym is going to have to think about differently.
And another question is, from a cleaning standpoint, equipment, mats, foam, and everything, would it just be your regular thing? You're just getting a little bit more into it? Or
this virus is really, it's pretty flimsy when faced with anything involving alcohol or detergent. And so those are the things you want to be using, but that's really in most cleaners. It's not something that survives cleaning products really of any type if you're using them effectively. And you really, equipment where people's hands go the most, you really want to target those. And obviously not just in the gym, but any kind of high contact area, doorknobs, other things like that.
Flat surfaces, counters.
Yeah, and you just want people, and people won't be upset if they see you constantly cleaning these things, almost to the point of, everyone will feel better, and you'll reduce the risk of disease spread the more you're doing it. And so
we just had somebody ask about carpet bonded foam. So, like the floors, the gym floors and so forth, Is there anything, because obviously it's a little bit difficult to spray it with detergent.
Yeah. I think is it plausible that, I don't know how long there's been no study of how long a virus can survive on carpet bonded foam. But, what I would say is that getting a little bit of virus on the bottom of your foot or something else, that's not a plausible route of infection, right?
Right.
The way that you're infected with this virus is you either inhale aerosolized droplet from somebody else's sneeze, or you touch a surface that has that and you put that surface in your nose or in your mouth. It's not implausible, but I think more things that you're looking at are more like your bars and other things that the gymnasts touch regularly and in the same place. Because also carpet bonded foam, you have a big, area there. Again, anything is possible, but you're looking to knock down the low hanging fruit.
Right. And the virus, it doesn't live an unlimited amount of time outside the body. I'm sure there's a limit to it. So I've actually read, and I don't know if this is true, but I've read that it's about, on hard surfaces like metal, it can be up to maybe a 12-hour lifespan outside the body, but on non-hard services, it's maybe as little as 6 hours or so. So
No, I think we read the same study, and
yeah.
that's about correct. Yeah.
So, Deanna, I know you've been asking about that. I would do your best, but I think we always need to go back to what Ed originally was saying, was we're all probably going to end up catching this at some point. What we're trying to do is slow it down, right? We're trying to make it a real slow burn instead of a rapid burn, because I mean, like anything, we kind of need that herd, inoculation, so to speak, I guess. And we're all going to get it, and we're all going to become hopefully immune to it. And most of us are not going to be badly affected. So we're just bringing the percentages chance down, because there's going to be people who are going to get sick, and they're going to need to go to the hospital, and that's just going to happen. We just want to make that, as a community, just make sure that that's as low as we can by doing as much as we can. We can't stop everything, right? But we can do as much as we can.
Can't stop it, right? I mean, that's the really, if there was a chance to stop it, and I rather doubt that there was, like the horse is out of the barn at this point, given how many communities are having, infections. And especially because our testing is so poor, there's a lot of estimates out there that the number of infected people are much higher. Now, that could be reassuring, because that really means that many infected people are asymptomatic, like we've been saying, right? But at the same time, those are increased opportunities for transmission to the most susceptible members of our population. And, you and I might be fine, but really the reason the American numbers are skewed right now in terms of mortality is the first place the virus burned through was a nursing home. Right. And when it goes through a nursing home, then you've got really big problems.
Right. And I guess the other part of that is, for us to not get too panicked when we start seeing large numbers being tested and found, because maybe we already have large numbers and the testing is just showing us what our situation is as we go through it. To not panic, but to actually just keep doing the good things that we're doing to help protect our grandmas and granddads and
when I first started working in a virology lab, and you're all gowned up and working with HIV, the rule number one is no panicking.
Right.
It literally never helps. And I think if we can just, the key thing, I think, is to make sure that there's no symptomatic individuals in your gym at any point.
Right.
If that's the case, and people are like, I realize that there's examples of cases where maybe there's somebody without a fever or symptoms. Like those people are going to spread virus in their community no matter what, because they're undetectable. But the vast, vast majority of people end up with a fever. The vast majority end up with some sniffly flu-like symptoms. If you eliminate those people from your gym, you're going to really protect the spread and make sure that you're not, on the news. Because it's, I think no one wants to get on the news, and you have to be careful of it. And that's the way you're going to do it.
Right. And I think it's important. Obviously, this is more of a marketing side of things, just to give everybody a little bit of an understanding of kind of what we're starting to see with numbers from a Facebook standpoint. Is, and I shared this with Ed this morning, is we're actually seeing with our clients, and we're dealing with a lot of clients, there's actually there's no drop off at all. In fact, there's a little bit of an uptick in inquiries to our gyms, as a whole. And we were wondering what that could be, and a surmising guess is that there are some parents that are starting to think about what are they going to do with their kids if there is a shutdown. So whilst there's what that says to me is there are parents looking for options, and we want to be that that available thing, as long as it makes sense. And I'm sure if it doesn't make sense, the authorities are going to tell us, look, time to shut down. And like you said, Ed, that's when the hurricane hits land, and then we hunker down for the 2 weeks or so, and we haven't necessarily preempted that, where we're hunkering down before it hits, and then we're needing to get up for air, and we can't, right?
Well, that's it, right? So if you close early, then you might not reopen, but you just have to make sure that you're not the one feeding the hurricane.
Right.
And I think there's a way to balance that. It's people are going to have to work really hard and think about things they haven't thought about in detail for a while, but it's not implausible, given that I think, the number of, students that most gyms have, which is compared to a public school, minuscule.
Right.
At least on a, people being instructed at any one moment. Now you got to clean in between class periods and things like that, but you can really make sure that you're not a risk to the community. And I think in any kind of communication or marketing, you want to emphasize the steps you've taken to avoid being a risk to the community. Because I think most people are now aware that their child might not be at risk,
right,
but people are still going to be socially conscious and might have a reaction of, oh, look, you're just ignoring this. I think you need to be like, no, we're not ignoring this. We're not saying this isn't a big deal. And here's what we're doing to make sure we're not part of the problem. I think if you do that, there's a path forward.
And I think, just for everybody, I think, if you have a bucket of, detergent water, and after each class, the coaches just wipe down all the surfaces and then the next class starts. I think that's a reasonable thing to ask for the coaches. And I think it does make a big difference, right?
Yep.
And Deanna asked, do you have any predictions? I know this is a really tough question asked. This is prediction kind of land, but do you have any predictions of the lifespan that this could be? Do you have any ideas of how many weeks or months that it could be?
Yeah, I mean,
really hard question,
as you kind of said, I mean, I would say that all of this answer would be wildly speculative, right? But I think you're going to see some geographic difference based on temperature and climate. There hasn't been enough information about this virus to know for sure, but its cousins, if you want to call it that, like SARS, really exhibited some seasonal sensitivity. And so I think you're going to see a downtrend in the months of April and May as it gets warmer, at least most states that kind of get hot and humid. And that's also consistent with, there was an emerging infectious disease meeting in Thailand that I was at maybe a month ago, and obviously everyone was talking about the coronavirus. But a number of Chinese tourists had also gone there that they thought were infected. And nevertheless, in Thailand, which if you don't know where Thailand is, it's really hot and humid. They've really not had the explosion that most epidemiologists were expecting, and a lot of people are attributing that to the climate there. So, and it's not to say, and I just want to make it clear, you can catch the flu in the middle of the summer and you'll be able to catch this, but the lifetime of the virus on surfaces like we've been talking about tends to go down, and that reduces the rate of transmission and the ability of one person to infect, dozens of people. Right. And that alone is, kind of reduces the spread of infection. But at the same time, you're also likely to see it creep back up in the fall, right? And that'll be another thing that we all have to figure out when we get there. Sorry, my son is coming through the window there. It looks like something miraculous is happening. But, but also at that point, there's the possibility of, therapeutic interventions. Like, it's not plausible to have a vaccine by the fall, but there are a number of things, even clinically approved therapeutics that for other diseases that seem to be somewhat effective against this virus. And again, even if we know that we can give those therapeutics to people earlier in disease when they're high risk, and then the burden on the healthcare industry is reduced, that makes this a completely different thing, right? But those things are not in play right now, which makes it more of a public, health threat.
Okay. And then Tanya asked, what is the thermometer that you guys are going to be using? I guess it's the thermo scan that you put on the forehead and rub it on, and it's pretty simple.
I think my wife has also ordered some of these like no-touch thermometers, which obviously even have, they're even more preferable, but in one of the least shocking moments in recent history, there's a little bit of a wait on those from Amazon.
That's right. So, I think on Amazon, I think it's like April 1st, but it might be worth getting 2 or 3 of them. And if you
absolutely right. I mean, it's a few $100, and that's the kind of thing that, like, even if they're all together, it's the kind of thing that will give people confidence that you're doing everything that you can to keep them and their communities safe. Right. And that's what we owe those folks now. And that's what we're going to need to do to, keep them coming to the gym.
A final question that I have here, if I don't get any more, is, should we keep the gyms warmer? Should we pump up the or is it,
yeah, I mean,
Because it is
Maybe,
winter,
but I
so
mean, like
it's,
it's Thailand. You're gonna have to make it pretty hot to make it like Thailand or Florida or the summer.
right.
And I'm not sure you want to do that. Our gym, we don't have. I think, although maybe my wife just added air conditioning in the major area, but it's a difficult environment to do
Would
gymnastics
there be
in.
an issue with air circulation though too? If you think about that, it's like if you're heating the building, you're pumping it up, it's going to be running really hard. If there's somebody who has an issue and they're coughing and they're in, is that an issue? Something to be
Yeah,
about?
yeah. I mean, it's important to realize that it's not. This isn't an airborne virus in the traditional, like in what airborne virus means to a virologist is means that like just from breathing, I'm going to get it, right? So
Okay.
you'd have to get like droplets in some sort of a system like that and then survive and then come out. Like, is it implausible? Like, no.
Right.
But that, you know, that would, I guess that's a reason not to do it, but I don't think that's a huge concern.
Right.
But
Okay.
every
So
ventilation system is different, I'm sure.
probably the
So
main reason not to do it is that you probably got to get it up to like 90 degrees, and that might
yeah,
not.
no, it's going to be hot. You're going to have a heck of a heating bill probably when your attendance is something on the order of 50% what it normally is. Make that decision for yourself, I guess.
Right. Okay. I think that's it. I don't think there's any other questions there. I think it's good to do this. I think what we will do, Ed, is have another get together maybe next Friday, and we can just maybe have a little catch up and kind of update as to what's going on if you're okay with that. I know
Sure.
people
No,
are
I'm
really
happy to help.
appreciating.
This is it's an unprecedented time, and I guess being a virologist on a board of education, married to a gym owner, I find myself in very unique space. So I'm happy to share any information that I have that can be helpful.
Yeah, and I've got to say, from a creatively disruptive standpoint, we really do recommend that knowledge and communication is really, really important with the parents. I think it's going to be your friend. One thing that we recommended to Ed's gym was that if you send out an email, to actually text the mums and dads that you've sent out an important email. If you send out that important email, this is what we're doing and this is what we're this and that, make sure that you text them to say, please check your email. We've sent you an important email. Please read it. Because the reality is about 15% of emails are actually read, and we want to make sure that these emails are actually read. And I think it's important, and it will help you. So I would really, really highly recommend that. Trish, I think you're asking about refunds. I will ask Ed. He's a virologist, but she's asking about parents that are asking for refunds. I don't know how Chris and Jim and I are handling the refund thing, where people are maybe asking for refunds right now. How would you handle that? I mean, that's kind of
Right.
more.
Well, I mean, I think we go by the month, and you pay for a month, and it's really not that big of a. If people are looking for 2 weeks worth of money, I don't know how we'd handle that. I'd have to ask my wife, but it's not like a big where we used to have like 2 or 3 sessions during the school year,
Right.
big kind of money where people would be asking for cash back. But I mean, I think in the end, you have to do right by people, like, and treating them right now, even if that means, giving them a little bit of a cash back. I think that you're going to build some goodwill. I mean, the only thing I would say is, in kind of one of those, can I stop you from doing that? Again, is there a makeup reality or other kind of thing that we can do to make it right without kind of a refund or without you withdrawing? And especially, if you have customers that realize, in the email that we're going to send out, tomorrow, we're going to make it clear that we appreciate people's support because, for us, and I'm sure for a lot of people, this is an existential threat. And it's not just like an extra $20 that somebody owes you. Like, if everybody, makes a run on the banks and wants to pull their kids and come back when the virus is over, well, the virus will be over, but there's going to be no gym.
Right.
And, that's not going to work with everybody. But I think, especially, hopefully a lot of these gym owners have made, ties to the community that matter. Now's the time to,
And I would agree from a business standpoint, my recommendation would be, depending on your gym, if your gym can't afford to give a refund to keep the relationship going, then maybe that's something to look at. If it can't, if it's difficult, to explain that and to make sure you're offering some kind of, like you said, makeup or so forth down the line. Because the reality is, what we want to make sure of is that all of the gyms are actually survive and do well through this. And it could get worse. It might not get worse, but it could get worse. And we need to be planning how that goes and make sure that we're able to come out the other end looking good. My hope is that you guys, Ed, and in the health profession, keep kicking butt and taking names and helping us guide through this, and it maybe stays at this level and for a while, and we get it under control. And I think what you said this morning in the meeting that we had this morning is that the hope is that everybody complains and says that this was a way overreaction, and that means what you guys have done has actually worked.
Right.
Because that overreaction is because, hey, it wasn't as bad as we thought it would be. Well, that's because these measures have actually worked, and that's a good thing.
Oh, absolutely. And like as a board member, right? Because, I'm willing to take the criticism, and I will have no problem sleeping at night if people think I overreacted.
Right.
But if other people, or more importantly, I think or realize I didn't do enough, that's when you're going to have trouble sleeping, right? And that's when you have to own a little bit of the blame. And
right.
I don't want that to be the case, so I'd rather get blamed. These procedures working will make it seem like we overreacted. That's what success looks like. And, I'm willing to own that. That's for sure.
I think if we as gyms are part of it, meaning we're part of a service to help be a place for kids to be safe and help families that need to go to work, and, especially the health professionals that need to get to the hospital, and, those that need to work and can't afford necessarily, $200 a day in daycare, that we should be a service to the community to help the community get through it, whilst being smart and taking care of the gym and controlling the environment. So we're part of the solution and not part of the solution. So I think in summary, guys, what I'm getting from Ed, and Ed, jump in if I've got it wrong, is stay open if you can, work and change what you're doing. Be very thoughtful about who's coming and going. Send out communications to the parents to show them what you are actually doing in a positive way to control the situation. If you feel that it's necessarily, limit the parents' viewership so they drop off the kids and the kids can be there and do their thing and leave. Make sure the coaches are washing down and cleaning everything between each class, which should be easy to do, and washing hands and so forth, and just being vigilant and keeping on top of things. Would that be a good summary?
Absolutely. And, just to pile on with like the coaches and everything else, I think it's really important to have a policy where people know if they're not feeling well or anything like that, like they'll be taken care of.
Right.
Because you have one coach come in and teach, 50 kids in a day, and have them be sick. You can't have that. And so you really got to make your employees realize that, they have not only a level of social responsibility to make sure that doesn't happen, but also that, it's easier to be socially responsible when you've got their back.
Right. Yep. So I think that's a good thing to end on. We're working towards, and from a creatively disruptive standpoint, we're actually working on some initiatives to help gyms, especially at the recovery end of it. As I said, we're seeing a little bit of an unusual uptick in interest in gymnastics during this period, which could be all sorts of things. I'm putting it down to some of the school systems closing down, and parents are looking at what am I going to do with my kids. So I think that's a really good thing to keep out there, and be an option for those parents that are looking for a destination for their kids. Like I said, Creatively Disruptive is working on some initiatives to help gyms on the tail end when we're trying to get back to normalcy. And I think if we all work together, we all band together and work at this, I think we'll all be fine and good. And we want to be looking after grandma and granddad and those that are a little bit more vulnerable. So with that, thanks, Ed. We'll chat with you maybe next Friday. Might not be as long. Maybe it'll be longer. Who knows? But
sure.
We'll chat.
As events warrant, man. Every day is a little different right now.
Right. So, but thank you very much. And just to remind everybody that Ed is working hard with the Loyola. Is it the Loyola Virology
It's the Department of Microbiology, Immunology at Loyola Chicago. It's at the medical school.
So he's right in the thick of things. So we've got a nice conduit to get some good information out there. So thanks Ed, and everybody. I hope this was useful, and we'll talk to you soon. Thank you.